Hey, everybody, welcome back to the Energy MD podcast, where we're on a mission to help 1 million people with chronic fatigue, long COVID, and MCAS take their energy and their health to the next level. So, really excited about our guest today. We're going to be talking with Dr. Jill Carnahan and her new book, Unexpected, and we're going to kind of dive into that and a number of the things that she's kind of been through and the things that she's learned from that. So, let's learn a little bit about her first. So Dr. Jill Carnahan is your functional medicine expert, duly board certified in family medicine for 10 years and in integrative holistic medicine. She is the founder and medical director of Flatiron Functional Medicine. As a survivor of breast cancer, Crohn's disease, and toxic mold illness, she brings a unique perspective to treating patients. She specializes in searching for the underlying causes of illness through cutting-edge lab testing and personalized medicine protocols. She has been featured in People Magazine, Shape, Parade, Forbes, MindBodyGreen, First for Women, Townsend Newsletter, and the Huffington Post, as well as seen on NBC News and health segments with Joan Lunden. Her YouTube channel and podcast features interviews with the healthcare world's most respected names in medicine, science, and functional medicine. She co-authored the Personalized and Precision Integrative Cardiovascular Medicine textbook with Dr. Mark Houston. Her new best-selling book, Unexpected, Finding Resilience Through Functional Medicine, Science, and Faith, was released in March 2023. She is also an executive producer and film writer and is featured in a new documentary about her journey overcoming illness called Doctor/Patient. Dr. Jill, thanks so much for being with me today.
Thank you, Dr. Evan. I'm so happy to be here with you.
So let's start at the very beginning, or let's start with your story. Tell us a little bit about where you're coming from and how you got here.
Yeah, so I grew up on a farm in central Illinois. I was one of 5 children, and you would have thought it was the most idyllic, healthy, Norman Rockwell-esque place in the world, right? Like a lovely environment to grow up, a lovely family. But unbeknownst to me, these chemicals on the farm and some of the things I was exposed to, probably even in utero, so in my mother's womb, were affecting me. And I didn't know that until I got into medical school. So I started pursuing my dream of becoming a doctor. Was in my 3rd year of medical school in Chicago, and I found a lump in my breast. Now I'm literally 24 going on 25 the next week or so. And I didn't think a thing of it. 20-year-olds don't get cancer, especially not breast cancer. But at this insistence of my then husband, I went and had a biopsy and a workup and ultrasound and all that. Ended up, I get a call from the surgeon just a few days after my surgery. And she said, Jill, I don't know how to tell you this, but you've got aggressive breast cancer. And ironically, I was at Loyola University, Stritch School of Medicine, in that medical arena, which was a pretty major medical center. At that time in 2001, I was the youngest woman they had ever diagnosed with breast cancer. So statistically very significant. Now, sadly, since then, we've seen a lot more women in their 20s and even like late teens with breast cancer. And it's part of the bigger picture, which I alluded to in the beginning. We're all swimming in toxic soup, and our world is becoming more and more toxic. And I think one of the biggest things, I know you see this as well with the fatigue and all those patients, is the toxicity of our environment is really affecting us to a degree like never before. And this was my first introduction as a student, getting cancer, to realize that this toxic world was affecting me. And I don't know that there was one thing that caused my cancer, but there's no doubt in my mind that those pesticides and hormone disrupting chemicals that I was exposed to on the farm, and that, like I said, probably even from my mother in utero. I think the same year I was born, there was a study out of Canada that showed the cord blood of baby infants born fresh into the world was filled with 200 or more chemicals. So, and that was 20 years ago. So all this to say, our environmental toxic load became one of my biggest passionate topics of discussion, because I realized that it was responsible in some ways for me getting aggressive breast cancer at 25 years old.
Wow. And so you were obviously able to finish med school.
Yes, I took 9 months off and did very aggressive 3-drug chemotherapy, pretty much everything they could throw at me. And then radiation, I had a couple surgeries, and about 9 months later, I was considered in remission. But I was so sick from all the chemotherapy. It's interesting, though, one little point for your listeners I think is so important is when we're faced with a life-threatening diagnosis or a decision, or as you know, as you're crafting a treatment plan with patients, I think one of the most important things we can do is it's overwhelming. And even for me, I'm in medical school. I have all the data at my fingertips, the libraries, the docs to help me. And it was still overwhelming to make a decision. But one thing I did, Evan, was I looked at all the data and I made a decision. And I decided at that moment, at 25 years old, I would never, ever second guess my decision in the moment, that I would just move forward without regrets. And the truth is, those chemotherapeutic agents, they probably saved my life. Who knows? But they also cause long-term detriment to my body, to my heart, to my immune system. And I've never, ever regretted doing that. And I think that's an important lesson, because so often we're faced with these really complex decisions in our healthcare. And the worst thing to do is live with regret. And so I think as we go forward, we need to just do the best thing we can at that time and then move forward. And I've done that since those years, because I had some sequelae just shortly after my breast cancer. After I was in remission, I started having cyclical fevers and I started having abdominal pain. And one day I was in the ER taking a patient's blood pressure, back on rotations after cancer, and I passed out. And I ended up that night in surgery for an emergency abscess. And I woke up to the surgeon telling me I had Crohn's disease. And this is literally like months, probably 4 to 6 months after finishing the therapy for cancer. So
Wow.
that was my second intro to autoimmunity and what that meant. And I'll never forget the gastroenterologist, telling me what the diagnosis was, saying you're probably going to need lifelong immune modulating meds, you're probably going to need steroids, you may need surgeries for bowel resection, and this is incurable. So that was depressing. And then right before I left, I said, well, doc, I want to do my part. Is there anything I can do with my diet? And he did not even pause. And he said, Jill, diet has nothing to do with this. And that was once again lessons about intuition. There was this place deep inside me that I didn't know what I was talking about. I had no nutritional training, but deep inside me, I thought, that can't be true. How can a gut disease not have anything to do with the external world and the environment and the foods that we eat? So I went on a search and I found the specific carbohydrate diet, and I started changing my diet because I thought, what do I have to lose? And within 2 weeks, my fevers went away. A lot of my gut symptoms improved. And it took me a couple years to really restore my gut to full health. But that moment when I saw the diet change did make a difference, I realized diet does matter. And I'm considered now, 20 years later, I don't have Crohn's anymore. It's what we call reversible autoimmunity.
Brilliant. And so it sounds like that kind of moved you. At that point, you were still kind of more conventional, but you were learning more about the natural side of things or the diet. When did you make a big pivot into integrative and functional medicine?
Well, the interesting thing is I grew up, my mother was a retired nurse, so she raised her children, and we had like a half-acre garden. So I was kind of enmeshed in the principles of more holistic, like food as medicine. And even though I wouldn't have called it that growing up, we grew our own apples in an orchard and made homemade cider. And like we had a garden with tons of frozen and canned fruits and vegetables every year. So there was a lot of emphasis on quality of soil, quality of food, quality of life, and understanding that the nature and the foods that we put into our bodies made a difference in our health. And we were fairly healthy growing up. And it wasn't like we didn't go to the doctor, but we never went to the doctor for first, like my mother would do an herbal tea or, something. And often we get well without having to go into the hospital. So I had these principles ingrained, and I kind of knew I wanted to do a more holistic model. And what I ended up doing is I went into medical school, but I kind of went with the idea that what if I learned the currently best reimbursed system in the US? And notice I didn't say the best system, because really all this is reimbursement, right? For insurance purposes, and really learn that system well, and then try to really shift and change how we do root cause, like trying to find root cause, and also trying to use the most natural ways for healing. So I kind of went into medicine with that idea, but my face-to-face encounter with death, mortality and possible death from cancer and then Crohn's really allowed me to go to where the rubber meets the road, is like, what am I going to do for my body? And I did some very conventional things, but then I also learned that diet, made a difference. And I also learned that supplements made a difference in my cancer treatment. And it wasn't until after I graduated from medical school that I first heard Dr. Jeffrey Bland, father of functional medicine. And many of us have the story where it was an epiphany, because as he was talking, I realized, oh, what I've always wanted to do is what he's talking about. I just didn't know it had a name. So then right through residency, I started doing training in holistic medicine, did my boards, and started learning from the functional medicine training. But once I heard Dr. Jeffrey Bland, I realized that there was a name for this medicine called root cause. And formerly, holistic medicine is really just how do we add in therapies and people that we know, like an acupuncturist or massage therapist or physical therapist or these other modalities. But what I wanted to do, probably like you, is what do I do in the clinic with the patient myself? Like, how am I looking at them? How am I assessing and treating them? And that's where functional medicine came in, because it really gave a landscape, a protocol for going deep into root cause of why someone might be suffering from chronic fatigue or migraine headaches versus just giving a label and a diagnosis, actually going to that deeper level. So once I found out about functional medicine, I really fell in love. And I think it was one of those things that I always wanted to do and didn't know it existed. And then I went and pursued that. So pretty much right out of residency, I was starting to do integrative functional assessments and plans.
Excellent. Yeah, I love the fact that you brought up the kind of the root cause versus diagnoses, and I wonder if you can talk a little bit about that. Oftentimes, people, there's a lot of security sometimes that people get with having a diagnosis, and oftentimes I'm telling them that that's very different than knowing what your causes are. Can you kind of speak to that distinction?
I'm so glad you said that, and you said it so eloquently, because truly, diagnoses are just a label, and a label gives us a reference. It's like a place on a map where we say, okay, I want to go here, and this is where we know it is. We know how far it is from our destination, how many miles it'll take, how much gas we need. So it gives us kind of a roadmap of where we're at and what the label is of the description of set of symptoms that we have. So it is helpful because doctor to doctor, like you and I talking, we can talk about a diagnosis and we know immediately what we're talking about. So it's kind of a common language that doctors can talk amongst one another, or if there's clinical research on a thing, we know what that means. But like you said, it doesn't say anything about what happened in your life. We're always walking on a trajectory, and we're always walking from point A to point B, and we're somewhere on that trajectory. So you and I are looking at the patient as if they're on a journey, and we want to say, where are you at in your journey, and how did you get here from there? And if we map that out and say, oh, well, this happened in 1980, and then 1990, this happened, and then 1992, this happened, and we're seeing these points in the trajectory of where something changed or shifted in the patient's health, we can actually go back and say, oh, well, maybe that move to that water damaged building started the process of your chronic fatigue and then your brain fog, and then you got early onset dementia, or I'm just making this up, but there could be this trajectory of episodes of things that happened. And when we do that, then we can go backwards and try to reverse some of those things. So for example, autoimmunity, you can look at the gut, you can look at the immune system, you can look at environmental insults, and you can look at what point did the immune system start to shift and attack self. And like I said, with my Crohn's disease, we have something now called reversible autoimmunity, which means if we go to root cause, I'm sure like you, I've seen cases over and over again where someone who's told they have a life-threatening autoimmune disease that is incurable gets cured or gets reversed because we go to the root cause.
Yeah, and I just want to put a greater understanding around that, where it really is, if you've got Hashimoto's or if you've got Crohn's or something like that, that isn't the cause. And oftentimes there's multiple causes.
Right.
In the work that I do for chronic fatigue, I call them the big five, or the toxic five: the heavy metals, chemicals, molds, infections, and trauma. And I'm curious about, like, what have you seen in terms of causes of autoimmunity and causes of fatigue and the work that you do? Are they same? Are they different? And which ones would you say, like, are most prominent for you?
Oh, I love that 5 roadmap because it's so, so true. Two things. Number one, if we look at autoimmunity, Dr. Fasano wrote a decade ago about the triad, and we see this common, whether it's MS, Hashimoto's, lupus, Crohn's or colitis, or any other even rare autoimmune disease that's not common. We know that at the core, there's a genetic component. There is an environmental insult that could be something as simple as gluten, or something as complex as heavy metals or mold or environmental input. So some insult that triggers the immune system. And the third thing is that gut immune interface. There's usually something wrong at that level because the majority of our immune system lines the gut. And so when we have an insult, permeability, mast cell activation, heavy metals, mold, and I could name 100 other parasite infections, dysbiosis, that in barrier from the gut lumen is impacted, and all of a sudden you have dumpage of the gut contents into the bloodstream, which overwhelms the immune system. And that immune system is there right on the barrier of the gut immune interface to protect us, because that's our interface with the environment. But because that overload of the immune system happens there, that's usually ground zero for autoimmunity. So we have genetics, we have environmental insults, and we have the gut immune interface. When we understand that triad, we can go to each of those pieces and do what we can to restore and reverse the things, the insults that were causing it. So that's like autoimmune in a nutshell. And then on this side, you said, well, what do I really see? Mine is a little more simplistic, although I think your 5 causes are actually way more accurate. I always think of it as toxic load plus infectious burden, and the interface of those two creating immune inflammation, dysfunction, and autoimmunity. And really, so usually my complex cases like chronic fatigue or migraine headaches or some new onset autoimmunity or brain dysfunction at the core involve some combination of toxic load plus infectious burden.
And by toxic load, you mean like heavy metals, chemicals, molds?
Yeah, so honestly, I'm just putting them in a bucket, but
Yeah.
yes, exactly. A big bucket
Yeah.
of mold, toxic, heavy metals, chemicals, all the things that we get exposed to, PCA or PCBs, and then PFAs are big now. Just, you could name 100 things.
Yeah, and I really, something you said initially kind of speaks to this too, is this um, a lot of people think that illnesses that run in families are strictly genetic,
Yeah.
but we know that so much of this gets passed through the placenta, right? So what are you saying? How much of some of these things that we think are genetic are actually just environmental being passed through?
I love that question because so it's we like the nature nurture question, right? And the truth is, whether it is someone who survived the Holocaust and had a baby in utero and had an imprint, we have the data now to show the science that a baby in utero, when the mother goes through a very traumatic event or a war or something difficult, actually imprints on the cortisol and the HPA axis of the baby. So they come out of the womb with HPA axis dysfunction or proneness to high or low cortisol, and that's literally imprinted. And that's and we have things like, say, a nutritional deficiency in a mother can imprint on the epigenetics of a child. So this thing is, yes, we pass on genes, but far less often it's a hardwired gene that can't be changed, and far more common it's an epigenetic imprint that's either nutritional excess or deficiency, chemical excess or deficiency, or some sort of stressor that makes an imprint on the transcription of genes, which means at the root, you and I know this can actually be changed. Because in that next generation, we can do some things with methylation or with diet or nutrition or decreasing chemical load that actually changes the gene expression. So I love thinking about that way because it's so much more empowering to patients to know that generally, even genetic expression can be changeable with the right inputs.
Hmm. Yeah, let's dive into resiliency, which you talk a lot about in your book. And it's so important, especially if we're looking at this example, where so much of trauma can be inherited. So we're already coming and we're getting all these toxins through the placenta. So we're already coming out of the womb into the world kind of behind the 8 ball. And then we accumulate our own toxins and our own trauma. And so, how does somebody create resiliency? How do they increase their resiliency throughout their life?
Yeah, so the idea of resiliency is so empowering because what happens is we all have suffering, and suffering is inevitable as a human being. And if we think, I think what we often do is we think we have control. I'm just going to take a little side segue for a moment with Hans Selye's work on stress and cortisol. He talks about the acronym NUTS: novelty, unpredictability, threat to ego or threat to health, and sense of control. Those are the 4 things that are most common to trigger a stressor or a stress response in our body. And the reason I bring that up is because all of those things, we think that we have control. We get health insurance and car insurance and house insurance, and we go to the doctor and we do all the right things and we try to eat the right things, and we still could get like me at 25. I was voted in my senior yearbook most healthy senior, like health conscious senior. Like I was the one of all of my high school classmates that rarely drank, didn't do drugs, ate really clean, exercised every day. And guess what? I was the one who got cancer at 25. And I would have thought in my teens and even early 20s, I was doing all the right things. So that was my insurance policy. but it didn't help, right? So that illusion of control, as soon as you kind of break that down and realize, oh, wait, suffering happens. And I know people listening, and you know from seeing patients, sometimes you have the most beautiful, wonderful family or person in your office that just lost their, their dad or their son, or their tragedy and suffering happens. So back to resilience. When we think we have control over this, it actually stresses us more because we're shocked when something bad happens, right? And the truth is, we're either having just gone through something crisis-like or tragic or difficult, we're in it right now, or it's coming up around the bend. Like, that's the only three options. So the sooner we get really comfortable with suffering and the inevitable difficulties of life, or even a difficult diagnosis or health issue, the sooner we can actually become resilient. Because when we start to recognize this is inevitable, suffering is going to happen, instead of resisting and trying to avoid it, we can't. And when we try to avoid it and then it happens, we're shocked and it's terrifying and it's so upsetting. But when we know it's going to happen, that's the part of resilience where we can say, okay, this happened. Sucks. I hate that I got cancer. But what can I do in the midst of the suffering, in the midst of the difficulty, in the midst of the new diagnosis of the death of a loved one, to actually take this, the thing that I can't change, and transform it into something that actually creates a better, stronger person inside. And I call that like transformation, right? So if we can take difficulty and allow it to transform ourselves mentally, physically, emotionally, otherwise. And this is really the real work behind trauma, because we all have trauma, big trauma, little trauma. I love that you include that. And I feel like so often when we get stuck in trauma patterns, it's the thing that keeps us from being resilient. And I am not saying that suffering is easy or that we shouldn't have deep compassion. I'm just saying if we expect it and then we reframe it, we can do a lot with how we reframe. And when we do that, and when we try to find the pearls and the important pieces and the lessons, all of a sudden, what could have been the most tragic thing in my life, my cancer at 25, turns out now I can talk about it as the greatest blessing, because it truly transformed who I am and how I practice medicine.
I feel like I just got called out because I do like to control my life,
Me
and
too. Me too. It's so easy to, yeah.
yeah, in the hope that uncomfortable things or suffering isn't going to show up, right? What does Buddhism say? All of life is suffering.
Yes, yes, yeah. And some
Yeah.
of those principles are really the ones that, and what's funny is, instead of, again, you think about it, I was thinking like a car accident and someone who's maybe been drinking, and they're just kind of like, they never get hurt because they're not resisting. They're just flopping around. They're kind of half not, sadly, and then the person who like sees it coming and braces and like their whole body stiffens, they often get fractures and head injuries and significant trauma because they're resisting what they see coming. And that surrender to life is so powerful in how we can become resilient, because when we resist it, we actually do more damage to our minds and our bodies.
Wow, going with the flow.
Yeah.
I mean, there's definitely lessons in there in business. If the universe is showing you something, you pivot your business in a certain direction, or you or with your team, or certain things that you need to learn at the right time. Very interesting. And so then, are there practices that you recommend? I know you kind of go into some limbic system retraining stuff in the book. What do you think are good ways to kind of practice going with the flow, surrendering to life, being more resilient?
Yeah. So, some form of practice of spirituality, I believe we all, and spirituality can be anything to anyone, right? It doesn't have to be a certain religion. But the idea there is, when we have, I love even going back to the research that Dan Buettner's done with the blue zones, and he goes to all the places where there's centenarians, the most common high concentrations of people who are living over the age of 100. He says, what is unique about this culture? And there's things like good foods that are local and sustainable, and walking everywhere, and movement, and connections with long-term, lifelong friends. Those are all great. But one of the other things he found across cultures of all different places, Japan and Greece and Costa Rica and Loma Linda, etc., was they had a purpose and meaning. They had this greater idea that their life had a meaning and purpose beyond just themselves. And when we have that greater purpose and meaning, which again can be a form of spirituality, it actually, I think, invigorates us to live in a different way, to live with generosity and live with love and live with this greater good for humanity. So that's one of those pieces. And then the personal practices for me, it's like walking in nature, being connected to nature. Breath work can be an avenue. I do prayer and meditation as well. So that kind of connection with something greater than myself. And that's also where we can surrender and trust that the universe is working out things for our good. And again, everybody has different practices. For me, it's literally walking in nature, breath work, being with people I love, pretty basic things.
And they connect you to spirit. They connect
Mhm.
you to something larger than yourself. Yeah, that's great. Yeah, and so purpose and meaning. So can you give us some examples of purpose and meaning? Yeah.
Yeah. So I'll just take myself for example. So I feel like it's really clear I'm a healer, I'm a doctor, but underneath that, my real meaning every day is to glorify the divine and love people. So my greater purpose and meaning is how do I today in my interactions with my staff and my patient, my family, my friends, how do I show unconditional positive regard, or we could call it unconditional love, to every single person I come in contact with? Because so often the healing starts at this place where someone walks into my office and feels this many of our, I'll just go back to medical trauma, medical gaslighting is so common. And what happens, again, I know you see this with your clients and patients as well. People have been led to believe they can't trust themselves, that when they don't feel well, that doc says, oh, everything's fine, your labs look normal. And they start to doubt that their own intuitive body can give them information that's helpful. Like my chest hurts a little, and it might be just they're angry. It might not be that they're having a heart attack, right? But when we start to lose contact with our somatic senses and our body, and trauma does this too, then we start to not trust our intuition about what's right for us as far as health and healing. And we start to relegate that to an expert, like a doctor or a coach or someone else. And when we lose that connection to our body, it was like when I went back to the doctor in the gastroenterology right after my cancer diagnosis, and he told me, Jill, diet has nothing to do with this. I could have done this one thing, which would have been, he's the doctor, he's the guru, he knows best. Diet has nothing to do with it, even though my heart said that wasn't right. Or I could have gone the other way, which is trusting my heart and mind and body, saying, I don't know much, but my intuition says that can't be true. I'm going to search and find and see if this feels right for me. And then as I make changes in my diet, see if it's true. And I did, and I saw results. So that was trusting my body and heart. But for many, many years, I kind of dissociated from the somatic experience of living, and I could do a lot. I suppressed pain. I have one of the highest pain tolerance of anyone I know because of what I've been through. But by doing that, we're subjugating our human body to say, you're not valuable to give me information. Only can someone else outside of myself tell me what's true and right. And when we do that, we lose our ability to heal. So back to unconditional love and greater purpose, if I'm creating a space for someone to truly feel seen and to feel heard and to feel known, all of a sudden they start to be like, well, maybe I do know something. Maybe I do know what's wrong with me, or I can help the doctor get to the right answers, or I can even be part of my plan. What if that were true? And all of a sudden we empower that patient to give them purpose and meaning. So back to the greater purpose for me, it's that unconditional love at the core. And it's that giving empowerment to the patients in purpose and meaning so that they can start to trust their bodies to give them information and data that will guide them and lead them in a healing journey.
So well said. And so then you mentioned intuition
Mm-hmm.
and trusting ourselves when it comes to our health. Can you talk a little bit about how people can foster greater intuition with themselves?
Yes, this is the heart of what I do in my book and the resiliency there, because what I learned in it, all of this comes from my personal experience. So almost everything that I talk about is something I had to learn the hard way or the difficult long way. And so much of it is just coming out of this wellspring of like, oh, I've lived that. I know what it's like to not have intuition. And the important thing here is this. let's take autoimmune for a moment. We've talked a little bit about that. And I love Gabor Mate's work, Peter Levine, all these, I know you know some of the trauma experts, somatic healing experts, and they will talk about autoimmune metaphorically as attack of self, right? It's this body's immune system has turned on itself, and whether it's the thyroid or the nerve cells or the muscles or whatever organ, your body's attacking self. So metaphorically, there's something against self, self-hatred, self-loathing, parts of ourselves we don't like or acknowledge, or any number of things that is against self. And what I learned in my journey is, okay, we can talk about self-love. Let's start loving ourselves. Let's start being compassionate and kind to ourselves, which is part of the root of healing. But what I learned along the journey is you cannot really love yourself and your cells into healing until you trust yourself and your cells to give you the right information. So if I say, I don't believe any signals that come from my neck down, it's all here. And if my stomach hurts, I ignore it, I suppress it, it's fine, I'm fine. That's all this like denial of self and denial of my own intuitive innate healing potential in my body. But when I start to tap in and listen and say, oh, my heart feels heavy today and I'm sad, and I let that feeling flow through me. And that's part of the trusting myself, because then I get information that allows me to heal and move on. And I just learned in the journey, I hope this is making sense, but at the core, if we don't trust our intuition, our innate healing ability, and our innate ability to know what's right and wrong, and what might even be, on a cellular level going wrong in our bodies, we cannot really love ourselves. So it starts with trust, and then we love. And then when we truly, truly accept ourselves, just how we are, without wanting to change it, even in the suffering. Because so often, as you know, when people say, I have chronic fatigue, or I am sick, they become that identity.
Mm-hmm.
And you can't really change or transform until you start to love those parts of yourselves and realize that change is possible. And I think the intuition comes first. So trusting ourselves, loving ourselves, and then, and only then, can true healing take place.
Mm. And so how do you recommend that people reconcile or hold those different components of diagnosis or cause, or, okay, I know I have chronic fatigue and I have to work on it, and I don't want to identify with it? How do you rectify those?
Yeah, because you have to have we talk about the diagnoses in the beginning, right? You still need these labels that kind of guide and direct the path. So you get, okay, I need this kind of a protocol or plan. Um, but what happens is, and I love that you have trauma in your milieu of what do we treat, because this all relates to that. So often when someone is in my office and they've had chronic fatigue or fibromyalgia or some certain illness for 20 years or 30 years, there is some piece of that that they might be stuck with, because there's, again, this is going to sound really harsh, and I promise you it's not, but often there's a piece of ourselves that either identifies with the illness or that has a benefit from the illness. Let me tell you my example. I was 21 years old when I got married. I'm divorced now, and I immediately got married and had 3 children. One of them had disabled, totally Down syndrome and autism, and needed full-time care. I was in medical school, 60, 80, 100 hours per week, raising 3 children, new marriage. It was way, way, way more than I should have been able to do. But what I did is I suppressed my body. I was strong. I was tough. I grew up on a farm. Don't complain, pull by the bootstraps, all those mentality things, right? And I was like, I'm going to show up. I'm going to do this. And with the mental fortitude, I pushed through that. I got through. And guess what? Third year medical school, cancer comes. Now we talk about the chemicals and all of these other pieces of the puzzle, and those were part of it. But guess what else was part of it? Part of it was me suppressing my true nature, which was an actually highly sensitive, empathetic person who needed rest, who needed nourishment, who needed to not work herself to the bone. And that, I think that was part of my body actually saying, hello, Jill, if you're not going to listen to our subtle signals that you are not well and that you're pushing yourself way too hard, we're going to come up and show you. And again, metaphorically, I think the cancer and the autoimmunity was a wake-up call saying, my body was like, Jill, please, will you please be kind to us? Will you please be kind to me? And I was just like, shut up and behave. I'm going to push through this. I remember when I got my diagnosis in medical school, and I thought, I'm not going to take any time off. No one will even have to know I have cancer. I'm just going to work. I won't tell anyone. Well, the first chemo treatment put me on my back, and I was so sick. I realized real quickly there was no way I was going to continue medicine while I was doing chemo. But in the beginning, I thought, oh, body, you can just take a back seat. I'm just going to treat you with the drugs and we'll get through this. But I had no self-compassion. And so back to the meaning and purpose, sometimes these things come to into our lives to transform us and to shake us out of our reality and to get our attention. And sometimes it's the best gift in the world when an illness comes. So often, as awful as cancer and autoimmunity are, or chronic fatigue, they are a hello, are you there? Because your body and mind and spirit need transformation in order for you to get to the next level. And if we listen to that message, it can be transformational, but they're hard. And so again, if we ask ourselves, is there a reason this is here? And often there is.
Hmm. Yeah, and do you find that people do better in your programs when they do have that acceptance?
Yes, yes, absolutely. Because all of a sudden that there becomes, it's really kind of like deep trauma work, which I'm sure I'd love to hear more about how you address that, because I think there's multiple ways. But when we deal with those, because often again, there's an identity with that illness or there's a purpose with that. If we can kind of get to that root and pull it out by the root, all of a sudden it becomes unnecessary for us to be ill anymore.
Hmm. And health can, or the journey for better health can become a spiritual path.
Yeah. Hmm.
Hmm. So one of the things that we do is we complement the work we're doing with some trauma programs out there. Are there specific trauma or limbic system retraining programs that you find to be especially helpful for folks?
Yes, and again, you're probably the expert here. The things I've obviously DNRS, the Gupta protocol, primal trust, any sort of somatic experiencing therapy. And even if someone wants to do, I find that a lot of these people are type A and they're already like overloaded with their to-do list or their OCD in nature because of the histamine issues or whatever else is going on. And so some of these people don't need one more to do. And some of these programs are like an hour a day, this many times, very protocolized. So those programs are great for someone who needs structure. And again, there are most of them online, or you could work with a therapist weekly that does somatic behavioral therapy. Those are all great. But then there's the other side that some people, like myself in med school, just needed someone to take care of them. So then I recommend like massage therapy, cranial sacral therapy, binaural beats, thought field therapy, something where someone is actually helping them to take some of the burden off. So it's either someone needs more structure and then the programs are best, DNRS, Gupta program, primal trust, etc. Or someone needs actually someone to help and nurture them and their soul. And then it might be massage therapy or craniosacral or neurolinguistic. But in that realm, there's 101 different things that they can do. And really, it's just how do you get most awareness of your body and get back embodied in your body so that you can feel what's happening and learn to make the changes based on the signals that your body innately will give you.
Well said. So I want to touch on journaling a little bit and kind of the therapy of writing. Um, my wife leads a program that we have where it's like a 4-day journaling workshop for expressive writing. And you talk about something in the book about a letter to your dad. Can you
Yeah.
talk a little bit about this?
Oh, sure. You get to the heart. This part of the book was probably the hardest to write, and I wrote about something that was really difficult and beautiful in my life. So I have a wonderful family and wonderful parents, and I didn't have any big T, horrible trauma. But I definitely had little T traumas in my childhood that I started to realize. And one of them, again, my dad showed up, the hardworking farm kind of mentality is work hard, don't complain, all the stuff I just talked to you about. My dad was no different. And they weren't very expressive. This is kind of the German Swiss. So there wasn't a ton of like, really coddling the youngsters. And because of that, I grew up in this family. And I happened to, unbeknownst to me at the time, I learned this in my 30s, I was an empath and I was a highly sensitive person. And what that means is I feel emotions and energy of everything in the room. I mean, I could walk into a room and tell you exactly what happened before because I can feel the anger, the fear, the happiness, whatever. And same with my patients. Part of the gift now is I can really, really tap into what they're feeling and kind of understand them on that intuitive level. But growing up in my farm family, I didn't know this about myself. I just thought I was a freaky, sensitive girl that was totally an alien, like I didn't fit in. So all that to say with my father, who wasn't super demonstrative, but so loving. And in my youth, in my 7, 8 years old, I thought, am I lovable? Am I worthy? Am I special? All those things we ask ourselves. And I started seeing after my divorce, I was dating some really not healthy characters, some really bad. I told you some of the stories. I have a whole nother book in me about how I've already titled it. It's The Unicorn's Guide on How to Not Date Psychopaths. Because I literally dated 18 of 20 criteria for psychopathy, ex-felon. So that's my story. So that got me to say, okay, why am I choosing these men who are not healthy, not good, not kind, not nurturing to me? And what I realized was I had to really believe, this is also the self-work, that I was lovable, worthy, that I was special. And my dad, I knew he loved me. We had a great relationship. But what I realized was I actually needed to go as a 40-something-year-old woman to my 70-something-year-old dad and say, Daddy. And I never called him Daddy. We don't do that on the farms, Dad. I said, Daddy, my 7-year-old little girl needs to hear from you that back then I was special, of one of your 5 children, that I mattered. So I wrote this in a letter and bawled my eyes out in the coffee shop for hours as I wrote it out. And again, I knew my dad is so loving and so generous. I knew he'd be able to hear this and actually help me. Because for me, it was healing that 7-year-old, because what was happening was all these really bad relationship choices were coming from that 7-year-old girl who needed this reassurance, and she would choose men that gave her this false reassurance, but it wasn't real and it wasn't healthy. So I literally wrote a letter to my dad. I sent it to him by email. And of course, being the man that he is, within about 48 hours, he wrote me back. And he said some of the most beautiful things. And one of the most precious things that he said was, first of all, I love you. You are so special. You're the most incredible daughter I could have ever wanted. And then second of all, he said, that year when you're talking about, whatever year it was when I was 7 years old, he said, I almost lost the farm. And because he's a stoic farmer, he was mortgaged up to here and the crop wasn't going to come in. He thought he would lose everything and loses everything that provided family. So night after night after night, he wouldn't be able to sleep. And I could, as the empath in the family, I sensed that my daddy was upset. And I sensed that he wasn't okay. And I thought it was my fault. It wasn't. And he never did anything other than love me, right? But my sensitive little empath soul at 7 somehow integrated this idea that my dad was distressed and it was my fault, because kids are very self-centric and they don't know any better than to assume it's their fault. And so in me at 40 some years old, writing that letter to say, Daddy, can you help heal that little 7-year-old? And for him telling me, Jill, we almost lost everything that year. I said, oh, Daddy, I felt it. And again, we had this beautiful relationship. There was no fracture at all, but it went to another level when I wrote him that letter and I got his response. And you know what else happened? I never again, my relationships aren't perfect, but that moment was a turning point as an adult self of how I dated, because all of a sudden I was worthy of love and I chose men that treated me like that. And I never again had this awful, crazy experience with men, because I knew I was worthy and valuable. And I write in the book because I looked across my sphere of women, successful, and men, and I saw so many women and men, and I'll talk about women because I'm one of them, in the world, successful in business, successful in career, having it all together, and yet their relationships are falling apart. And I thought, I'm not the only one who needs to heal with her daddy or mommy. Like we often have, and this is that trauma, it's little T's, because I really had great parents. But even with little T's, like this little thing as a 7-year-old, it was my illusion that really affected my whole life. And so it was powerful in doing that work and the healing. And to go one step further, the writing, I feel like, is so therapeutic. The secret about writing a book, you probably know this as well, is it's almost like therapy because you have to understand yourself really well to talk about experiences and patience and things. And so as you're writing, you really have to work through any issues that are unclear in order to make it clear to your reader.
Yeah. I think, yeah, it's such a great story and such a great reminder. And I hope that everybody listening to this takes to heart that idea and hopefully goes and writes a letter to their parents, writes a
Yeah.
letter to their dad, writes a letter to their mom, and hears back the words. That's part of it too, is that you could potentially even write your own letter back to you, probably, if you didn't think you were going to get the response that you wanted, and shift that relationship. I know for me, I actually got really upset with my father when I went to college. I would call him up and yell at him and tell him that he didn't love me because he was a stoic German.
Yes.
And I know that there was a lot of stress, a lot of financial stress and other stress that he had when we were growing up. And I'm sure that I felt it. I'm sure I felt it. And I was like, And he would show up at all my baseball games and my sports games and coach all my teams, but that's not the way that, I felt like I wanted to be loved or I needed to be loved. And so consequently, we had that rub for a while until I was able to accept him and understand who he was. And what you've just said just now gives me even more insight. It makes me want to deepen that relationship with him. So thank you.
And thanks for sharing, because I think all of us, like, right, who has perfect parents? And again, I had really good parents, and yet I still have these wounds. And when we heal those wounds, then we can show up fully with all ourselves. And that's part of the physical healing too.
Amen. So we got a couple minutes left here. And so I know that you have a free gift for our listeners and our watchers on YouTube. It's a chapter from your book, right?
Yeah. Yeah. So if you're not sure you want to read it, you can just read the first chapter for free and see if you like it or not. It's just readunexpected.com/free chapter. So readunexpected.com/free chapter.
Yeah, and we will definitely drop that link below. And then where can people go and learn more about the amazing work you're doing in the world?
Oh, thank you. My main website is just Jill Carnahan, my name, JILLCARNAHAN.com. And there is blogs from decades, podcasts, all kinds of free resources there. And you can also follow me on Instagram at Dr. Jill Carnahan.
Brilliant. And we'll drop those links below as well. Anything that you want to say about the book, Jill, that I haven't said already?
Well, no, just thank you for going to some of the deep places. And there's all these how-tos out there, and they're beautiful. And hopefully mine is a how-to as well. But I think so often I'm not unique in my story, and everybody listening has a story. And when we start to tell our story, it's connective tissue to the world and to our friends and our family and our patients, or even our doctors if you're a patient. And I love the idea of story as healing. So if you have a story, like you mentioned earlier, go and start writing in your journal, because I'm not unique that I have a book. You can do the same, and you can start by just writing down these experiences, because as we journal and write and process them, often they give us insight into ourselves, into our history, into our families, and even into our own healing journey.
Yeah, and I think it's, picking one of those spiritual paths that speaks to you most. Like if you're not into prayer or meditation or walking in the woods or whatever it is, maybe writing is
Yeah.
for you, so we get to know ourselves better, and the better we get to know ourselves, the better we can connect with everything, and the better we can heal ourselves.
Yeah. Thank you. And thank you for the work that you do. I'm so grateful to be here with you.
Thanks so much for coming on, Jill. I appreciate you.
You're welcome.
I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening, and have an amazing day.